All right, so this is one of our functional taping for musculoskeletal injury tape jobs associated with like a gamekeeper thumb or a thumb instability. I like to call it soft tissue thumb. So what we're going to do is we're going to measure from the inside of the thumb around the thenar eminence, and it's going to wrap around almost like a fascia line around the arm. We're going to use, that's going to be our measurement. What we're going to do is cut that tape into two 1-inch strips. Now we'll start by breaking a 1-inch box. And we're just going to apply that tape gently with no stretch. Come around the inside of that thumb. And now we're going to block the tape so that we don't create any numbness. And the patient usually tells us exactly where that weakness is. So you can see on our doc right here, if I push in, I'm actually relocating that joint. So I'm going to apply a heavy stretch right over that. And then it's just paper off tension. The rest of the way, almost like just allowing the tape to fall down in a spiral line. Now, we're going to do that with a second strip to add a little extra stability. Once again, applying that tape. Now you'll notice I try and stay off the thenar eminence as much as I possibly can, so if they're washing their hands, we're going to be able to prevent this from falling off too easily. Now, once we have that tape on, this might be all the patient needs. This might give us more than enough stability to actually take the job. However, if they're saying, yeah, that feels pretty good, but we want to actually get a little bit more out of it, we can use 1-inch leukotype. Relocate that thumb ourselves. And we're just going to follow that right around. So now that, every single time she uses that thumb, she's going to notice it's going to block the translation of that joint into instability, and it's going to give you a lot more support as you're going through all of your soft tissue work, or just generally at night, because one of the things that you have a problem with when this type of an injury, sometimes just sleeping at night creates pain, because what we'll do is we'll curl up or put our thumb in a bad position and create strain on it. So this is a nice tape job for either sleeping, or for myself in particular, I'll actually wear this if my thumb's bothering me a little bit during some soft tissue treatments. So again, we use this for thumb instability at the carpometacarpal joint or at the metacarpal phalangeal joint.